Perform hand hygiene. Hello, my name is Jeanette. I'm going to be the nurse helping you today at the appointment. Can I have you verify your name and date of birth?
My name is Jane Doe. I was born May 5th, 2008.
Okay, looks good. So it looks like for today's appointment, we have a neurological assessment as well as a genitourinary assessment. I'll be explaining everything as we go. If you have any questions, let me know, okay?
Yes, that's fine.
Alright, so first I'm going to ask you a couple questions about your neurological health. Have you been experiencing any headaches lately?
No.
Any recent head injuries?
No.
Do you ever feel dizzy or like the room is spinning?
No.
Have you ever had any seizures or tremors?
No.
Any numbness or tingling anywhere?
No.
Alright, any difficulty swallowing or speaking?
No.
Have you fainted or blacked out recently?
No.
Alright, and lastly, how has your mood and mental health been? Any changes in your mood, like depression, nervousness, anxiety?
I've been a little anxious.
Alright, and what is it that makes you anxious?
School, all the work I have to finish because I'm moving schools.
Okay, you're moving schools. That could be a big change. I know that's a lot of changes all at once, so that's something that you can be anxious about, but sometimes you can find hobbies or outlets to kind of ease your mind when thinking of that. Alright, now we're going to move on to your your neurological assessment. What I'll have you do, I'm gonna have you close your eyes in a minute, and then I'm gonna place something in front of you, and you're just gonna smell and tell me what it smells like, okay? All right, you can close your eyes. Oh, sorry, you can close your eyes. I'm gonna open this alcohol. Well, I would open an alcohol swab, put it in front of their face. What does that smell like to you?
Alcohol.
Okay, you can open your eyes. Alright, alcohol swab. I'm gonna poke you use an instrument and you tell me if you feel sharpness or dullness, okay?
Okay. Sharp. Dull.
Okay, awesome. Now next we're gonna have you look at the lines up there with letters, and which line can you read?
The bottom.
The bottom one, can you read that out loud for me?
A, B, C, D, E, F, and G.
Okay, now I'm gonna have you cover one eye, and then you tell me how many fingers I'm holding up.
2, 3.
Okay, now let's do the same with the other eye.
2, 4.
Awesome. Now I'm just gonna have you. I have this pen light, and I'm just gonna have you look at the tip of it, and then just follow through. Don't move your head, just with your eyes. Again, follow through. Okay, now I will shut off the lights, and I'm gonna check your eyes with this light. Okay, so I'll shine light in your eyes. You can just look at that distant object. Make sure they constrict. All right. The size is 2 millimeters. Okay, so now I'm just gonna have you bite down, and then try opening your mouth. Okay, good. Bite down again. I'm just gonna feel. Okay. And now I'm gonna have you close your eyes tight. Okay, you can open your eyes. I'm gonna have you smile, frown, and then puff your cheeks. Okay. Now I'm just gonna have you cover one ear, and I'm gonna whisper something in your ear. Let me know what you hear. Apple pie.
Apple pie.
Let's do the same with the other ear. Blueberry pie.
Blueberry pie.
Okay, sounds good. Now next we're going to, I'm gonna have you open your mouth, say ah, and I'm checking your gag reflex. Okay, gag reflex. I would reach further and then see if the gag reflex is intact. Can I have you move your head side to side, up and down? Great. Okay, now actually, can you stick your tongue out and then move it side to side? Good. All right, now I'll have you shrug your shoulders. Good. Right, it looks like that's it for now. Now I'm just gonna have you check your muscle strength. I'll have you grab my hands and squeeze them. Awesome. Now can you pull towards you? Okay, push away from you. Good. We're gonna do kind of the same thing with our legs. So I'll have you push down on my hands like a gas pedal. Okay, now pull up. Okay, good. Now can you stand up and walk? Just do your normal walk. Steady gait. Okay. Okay, you can go sit down. Okay, now what I'll have you do, wash my hands, put on new gloves. I'll have you touch your nose to then to my finger, okay? Okay, let's do it with the other hand. All right, now let's go back and forth. Awesome. Good. Now what we're gonna do is I'm gonna check your reflexes on your knees. So I'll use an instrument to check reflexes. Have your legs dangle. Okay, we got some movement. Good. Now we're gonna look over, ask you some questions about your menstrual cycle. How is that? Are your periods regular?
Do you have?
Yeah.
Regular.
Regular. Any pelvic pain on this area? You feel like?
No.
No pelvic pain. Okay. You have any itching or an abnormal amount of discharge that comes out?
No itching.
Okay. Do you use any birth control? Any past pregnancies?
No, none.
No, you're not sexually active.
No.
I would ask you about your urinary symptoms. Any burning, frequency, like you pee a lot or you leak when you can't hold in your pee or something like that.
No, everything's regular.
Regular, you'd say? Okay, everything's regular. Now for the physical exam, I would ensure privacy. I would inspect her genitalia, the color, the swelling, any symmetry, rashes or discharge. Gently palpate it for any masses or lesions, any tenderness. And I would complete that for the female. For the male, I would ask around the same questions. Do they experience urinary frequency, getting, burning or pain when they urinate, any trouble starting their stream to urinate, any about the color of the urine, any pain or sore swelling in the scrotum, or any discharge, about sexual activity, contraceptive use, STI exposure. And then for physical, I would inspect the penis for any lesions or swelling, gently palpate it, the testes to check for tenderness or any masses. And then that would probably complete that. And so that looks like that's the end of your assessment. Did you have any questions for me?
No.
Okay, sounds good. Thank you.
Thank you.